Hi everyone, today we are going to talk about the difference between apraxia of speech and phonological disorder, as one of you all had asked us to talk about this. So they look quite similar, they appear to us clinically very overlapping in symptoms and the way they manifest, but they have their own differences, and the approach towards each of them, what we need to carry is different. So let's just talk about the cause. So cause of apraxia of speech is more to do with the motor speech programmer, where your brain, the motor speech programmer in your brain, is unable to sequence and program the utterance that you want to say. As a result, the exact articulation of that particular sound is not produced. So you will see that the errors are infrequent, because sometimes it will happen, sometimes it will not happen, sometimes the motor speech programmer is able to do it, sometimes it's just not able to do it. The involuntary utterances are better because they are more so not in the control of motor speech programmer, they just happen, and that's how they come out so proper. But voluntarily, when your brain wants it to do, it does not happen. So here it's not that the child or the adult does not know what sound they want to produce, they know exactly, but it's the support that they need for programming is absent. Phonological disorder, on the other hand, is seen in children when they are unable to outgrow certain phonological processes. So as they are developing, there are certain phonological processes that bound to occur. If at right age they are unable to outgrow them, they tend to occur in the form of phonological disorder. Thing is, how do they appear? So childhood apraxia of speech or apraxia of speech in general tend to affect sounds which are infrequent, which are complex, which are not produced very easily on voluntary commands, and they are very easily produced on involuntary commands. They tend to worsen with the complexity. So the fricatives are more tough than the stops, affricates are more tough than the fricatives. That's how the complexity gradually increases, and the difficulty also increases. The groping movements are present. Now, the groping movements are a typical feature of apraxia speech, where the child is trying or the adult is trying to produce that particular sound, but unfortunately is unable to do so. On the other hand, phonological disorder does not have such things. You will see that there are certain phonological processes that persist. For example, reduplication, cluster reduction, simplification. You will also see something like backing of the sound, fronting of the sound, something like that. But the errors are here also inconsistent. So some sounds are mastered in one particular way, and the other ones are not there in the other way. So you might observe similar sound produced in a different manner in one position and a different manner in the other position. So you need to be really vigilant, because wherever the error is produced, you need to identify that what process is used there. How our approach towards both these situations change. When the person has apraxia of speech or a childhood apraxia of speech, our job is to teach this child motor speech programming, or basically speech programming. So how do we do that? So we go from very basic. We just first let him program all his speech sounds by using multiple cues. So the best process in which you can do it is by using tactile, visual and all those cues, auditorily and everything. Then you get the child to make aware about the sounds. Slowly you try to take it to a voluntary level, and then from there you take from involuntary to voluntary level. So there are steps which we can post, and we can all brush up on it. On the other hand, phonological processes are different. So here in this disorder, you need to make the child learn a particular rule of phonology and then apply it in different situations. So your approach towards phonological disorder would not be teaching him a particular sound, but making him aware of the sounds. Phonological awareness is what you will be working on. Phonological discrimination you'll be working on. You'll play a lot of games around the phonemes and make him or her understand about the presence of that particular phoneme. So in short, this is the difference between an apraxia of speech and the phonological disorder. I hope you find it useful. Keep sharing, and thank you.